Good morning. We're going to be talking this morning about a very important topic, the impact of tinnitus on adult cochlear implant recipients. And it's a first study. I understand it's the first study ever done in a random trial. So if you would introduce yourself, and we will start talking about what you've done.
Yeah, thanks a lot for just having me there. So my name is Assouly. I'm a PhD student working at the UMC Utrecht, which is a center in the Netherlands, and I'm also working at Cochlear in Belgium. So for my PhD, my main aim is actually to assess the effect of cochlear implants on tinnitus, and that's why we are doing this randomized control trial.
Well, how did you fall into the topic? Why did you become interested in the study?
So I have a biomedical engineering background. So I was already really interested into biomedical small implants and everything linked to neuroscience. And we all know that tinnitus is a disease with a high burden, where there is still a lot of things to do using electrical stimulation or neuroprosthetics. So combining kind of my willingness to help people do innovation and also work on, neuroscience and neuromodulation, I kind of combine everything trying to find a cure for tinnitus with the research I'm doing.
Well, tinnitus obviously affects millions and millions of people. It's very, very disheartening and disabling when somebody develops tinnitus. But your hypothesis was the fact that cochlear implants would be sort of a cure for it or a treatment for it. And how did you design the study to do this?
So yeah, it all started with the fact that cochlear implant is, a standard treatment for people having severe to profound hearing loss. So, and from this population, we have learned a lot of observation that tinnitus was actually suppressed or even improved after cochlear implantation. So based on that, we already knew that there could be a positive effect on tinnitus with cochlear implants. What we don't know is that these people are taking the cochlear implant for their hearing loss. So we want to know what is the effect if people get a cochlear implant for their tinnitus first. And that's how we actually started the study, thinking, okay, we are going to recruit patients who are seeking help for their tinnitus. They also have mild to moderate hearing loss, but they really are willing to get treatment for their tinnitus first. And then we want to see if there is an effect on their tinnitus first. And of course, if hearing loss can also improve, that's, a really good outcome. But we want to see everything from the point of view that tinnitus could be treated with these implants, and that hearing loss could be something on the sides. And that's why we have this big study where we have one control group and one group who will get the cochlear implants. And then we will just follow them during 6 months and see if there is a difference between the two groups.
So this was basically self-reporting after a period of time. It's all self-reporting. So that people's perceptions may be slightly different. Did you use a numerical scale for people to report how bad their tinnitus was?
Yeah, so we use, several questionnaires, but among that there is the VAS, which is a visual analog scale. So you have to rate your tinnitus annoyance and your tinnitus loudness on a scale between 0 and 10. And we also use the tinnitus functional index, which is a big questionnaire with a lot of questions about tinnitus related difficulty, how you feel about it. And that's actually what we really think is the main outcome. This is this tinnitus functional index. And we are going to compare the score before implantation and after implantation and see if there is a decrease or not, and try to see if this is clinically relevant.
It's a very common question on all the social media sites I run and the people I've helped or spoken to, that they want to know ahead of time, will a cochlear implant help me with my tinnitus? And obviously there are no guarantees in life. What kind of percentages did you find when in the study that it helped people or not?
So So based on another study, not the one we are currently doing, because I mean it's still ongoing, so I cannot really say something about that. But I've been working on big databases where, I mean, based on like 300 cochlear implant recipients, we could see that on average, like 3 out of 10 people say that their tinnitus is suppressed, and then 4 out of 10 others say that their tinnitus is significantly reduced. So we could say that on average, there is between 60 and 70% of cochlear implant candidates who will get their tinnitus improving. But of course, there is also this over 30% who will get maybe no change in their tinnitus, or even more, they can maybe have a tinnitus worsening. And that's something which is happening in maybe 5 to 10% of cochlear implant recipients. And as we say, for now, we still need to do further research to understand why the majority gets an improvement, but why there is some people who do not get this improvement. So currently, we are still lacking of a lot of data, and also, I mean, over research to make sure we can predict who will benefit from it and who will or might not benefit from it.
Now, your research it's going on now, you would expect to publish in a year or so, or how much more time do you think? About one more year?
We still need to recruit few people. So I will say that, yeah, in 1 year from now, we will be able to have all the data collected and be able to publish about the trial.
Are you recruiting people online through social media?
Yes, but only in the Netherlands. So because, I mean, we need to have a surgery and the patient needs to go back to the clinic several times, I mean, in 6 months, then it has obviously to be in the same country where the hospital is. So for now, it's in the Netherlands. But we are also doing other studies, which is mainly then on questionnaires. And for instance, the new paper that I published was something online where everyone in the world could just, I mean, type in their reply in the survey and then could be analyzed for further research. So for now, there is no study ongoing all over the world online, but that might come. And then it's possible to maybe have further people just being there and replying to some questions.
How many cochlear implant operations are there a year in the Netherlands?
Ooh, it's hard to say. That's quite a small country, but I mean there is a lot of big centers who are kind of with good expertise. So I would say maybe 300 or 400 per year, but that's something to be checked, I would say.
That's still a good number for a study. There's no question.
Yeah.
Okay. My next question is, people in your study who had severe tinnitus, got a cochlear implant, has anybody expressed regret about getting the cochlear implant?
I mean, currently not, but I mean, as I say, it's just we need more patients to make a conclusion about that. So, but for now, everything is fine.
Okay, now tinnitus itself, like I say, it affects millions and millions of people. And the issue is, as a neuroscientist, are you working on, or have you studied the causes of it, or are you just accepting that it happens and we'll look for a therapy?
I'm more in the second option, as you say. But the good thing is that, I mean, it's not only me who is working on that. So I'm also a part of a European research network where other researchers are working on the causes and diagnosis of tinnitus. We are exchanging every 4 to 6 months about what we find and try to collaborate. So I'm more into the treatment part where I want to see if we already have something which is working. But I also rely on my colleagues to see what they have done and maybe try to adapt the treatment I have.
Okay, that makes a lot of sense.
Yes.
The next question I have is the subjects themselves. When you recruit them, are they anxious to take part in your study, or do you have to push them forward to do it? Are people anxious to be part of this?
So, I mean, it really depends on people first. And I mean, what we do within the recruitment process is that we explain several times what are the risks, what are the benefits. And we also check that the patient who are going to the trial really understand these two things. So that's, I mean, there is also a risk that tinnitus will not change. There is a risk that their hearing will change. And that's where we select the people who are really willing to go to the study. So we do not push them to go. If they are anxious, then they should think about it more and come back to us when they are ready. We do take people who are really willing to go to the study and who are, yeah, just motivated to be there without being stressed, I hope.
One of the other things I find interesting, which obviously makes sense when people take off their cochlear implant or the hearing aid at night, the tinnitus comes back.
Yeah.
Do you have any views on that, why that happens?
So we think, and that's something which is kind of really observed in the current studies and other studies, which is that the cochlear implant is working because we provide an auditory input to the brain. So by having the cochlear implant, you really send electrical stimulation to the auditory nerve. And by that, the brain is actually not filling the gap anymore because he received enough inputs, so he do not need to create the tinnitus. When we remove the cochlear implants, then there is no input anymore. And so the brain needs to fill the gaps because he do not have enough information. So we think that this kind of observation, which is that we can kind of turn on or off your tinnitus, show that the electrical stimulation is working to suppress tinnitus, but we still need to understand why in a way and how we can optimize the stimulation to make sure that maybe we could suppress it for a long time and not just having in or off. But still, we need further years to think about that and understand more what is happening.
I think as a neuroscientist, you have your work cut out for you. You have the
Yeah,
therapy part, and hopefully you'll one day find out the causes, because it's just a very debilitating disease.
yeah.
All right. You know what I'd like to do, though, is follow up with you probably when you have the second study done, and we can find out what your observations are there. I will have a link to your study on this at the end of this so that people can read it for themselves. I found it absolutely fascinating. So I thank you for your time. I thank you for your observations. And I look forward to doing another interview with you in the future when we have some more information to share.
Thanks a lot, Misu. Thanks for your time.